Today we're going to talk about a tilt in space wheelchair. This chair is somebody that is in a chair and depends on a caregiver for all their mobility and also their movement inside the chair. And generally what a tilt in space does is it has the ability to tilt the patient back, and the way that is done is by using this foot pedal, and you can put a person in this position, which allows, the biggest thing about tilt is it allows for pressure relief and also change in position. It gives this person that ability to do all that and still stay in the wheelchair. Generally what happens is before tilt was brought out, this person would have to go home and sit for 2 hours in a bed or get other type of pressure relief done and get off their bottom and out of the wheelchair. So what this allows, say we're at a doctor's appointment and we have to wait for a little while, we could do a tilt like this and start getting our pressure relief and get off our bottom, and it just helps with any positioning. You know, as the day progresses, our head gets heavier, we may lose some lateral control, and this all helps with different features like that. So, and the tilt can be put in pretty much any position once you release the foot pedal. So a lot of times what will happen is somebody has to be set at 30 degrees after, say, they're eating, after they have eaten. So the tilt could be put in that position, and they have to maintain that position for, say, a half an hour after every meal. So that allows, this chair allows you to do that. Some of the other features with this chair is it has the chest strap, which is somebody would need proper chest control there. And this is a 4-point harness, so it goes over the shoulders and it also joins down at the hip area. So in order to get a patient out of this, you can release it and bring it this way. And then, so there are various different chest straps in the industry, but this one happens to be a 4-point chest harness. Most chairs will have some type of seat belt or positioning belt that is used to help keep our patients in the chair. Some of our facilities do not like any kind of seat belts or any kind of harnesses, and so they try to be restraint free. So that can be very difficult in some of our seating aspects that we have to do when we don't have a seat belt to kind of hold somebody in at the hip area. So this has a smaller rear wheel, and then which allows the chair to have a little smaller footprint. Most of somebody that's in a tilt in space chair will not be doing any self-propelling. This is an attendant chair that is an attendant will push this chair for the patient, and in general they do not do any kind of self-propelling. That's in general, but there are applications when that may be needed. So you can replace the smaller rear tire with a little larger tire to enable the patient to do some propelling. But one of the issues is that the axle or the wheel tends to be a little bit further back from the patient. So they have to have a very good range of motion or the ability to reach those wheels. So it's not something that I would always recommend to do. But as you'll find in this industry and out here in the field, we have to do things sometimes that's gonna work for our patients. It's not all textbook. And that's the beauty of this job, is that we can do different things and we look at a different situation. So together as a team, we're going to work together at different things that your patient needs. So that's when we may come up with, you want this type of arm with a little elbow support, because that helps hold your patient's arm on the armrest. Because when we do a pretty severe tilt, if they do not have very good control of their arms or they have weakness there, their arms could fall off. And so then this will help hold their arms on. We also have some little foot supports here that are made to help support their feet. So when they do tilt, their feet won't fall off the foot plates. We have a little foot strap here that can be used as a calf strap, just to help hold their feet in a little more when they're in the tilted position. So, and then just to clarify the difference between tilt and recline. So tilt, as you see what I'm doing here, I'm tilting the whole top of the chair. So our hip to back angle will remain the same. So now, if I was going to talk about recline, now what happens is the back angle opens up and the hip to back angle opens up, similar to our recliners at home, which your lazy boy chairs, which you lay out and do that. One of the biggest differences between tilt and recline is recline, once you recline your patient and you go to put them back up in the right position, they have moved a little bit. They tend to, there's shear forces there that allow them to move. With tilt, that person remains the same. So, and there will be an application on our power chair that you'll see that somebody that is independent with a power chair can tilt themselves and do their own pressure relief. So, but in this case, this is an attendant chair, and the tilt in space will work very nicely with this foot pedal. And a lot of times we're using this for our more severe population. We may be able to put more adaptive seating with molding and different things. We put laterals. Of course, we have a headrest here. And once again, there are many different headrests out there that will help with lateral control and head control and things like that. This chair is a pediatric model chair, tending to be a little smaller than for our adult population, but they all work similar with the tilt, and all the newer chairs generally have a foot pedal now. So, but that's where, as an assessment process, that's where you and I come together as a team to decide what size chair you would use. But for the application today, this is the chair I had available, and it is a pediatric model, so you can see that it will go to very small up to a very large patient. And sometimes in our larger patients, when we have weight issues and things like that, there are certain brands and frames that we need to go with. So once again, as a seating team, you would work together with your supplier or your vendor that would allow you and give you that input on that.